Hello and welcome. And today I'm very pleased to welcome back again Dr. Kate. You're back again. Well done.
Hello.
So once again, we've had a whole bag full, I was going to say bag full of posts, metaphorically speaking, of people's questions. And the most common ones we've sort of condensed and brought back to give to Kate to answer. And so although we are answering, and you may recognise that they might be your questions, obviously, as we don't know people's medical backgrounds, it's not a specific diagnosis or prognosis or whatever the word might be, but it's just to give you a general flavour of hopefully what your GP would answer for you. So, Kate, let's kick on now with our first question. And the first one is very much around, which is a lot of our audience, around menopause and HRT. And one of the questions that we've had in various shapes and formats were, am I too young to go on to HRT? And is there an optimum age?
Okay, thank you. This is something that I do see in surgery quite a lot around the starting of HRT, which obviously has, particularly in recent years, received a lot of media coverage. HRT is still not for everybody. But I think there are also a lot of sort of misunderstanding about when HRT can be started. And I think, I think it's important to say that you don't need to wait until your periods stop, and you don't need to wait until your symptoms are very severe before, you can consider HRT. In this country, the average age for the menopause is around 51, but that can vary hugely and can often depend even on your sort of family history, and a number of other sort of circumstances. And the perimenopause can actually start maybe up to 10 years before your periods stop. And what we have seen in recent years is that research does suggest that there can be some really meaningful benefits to starting HRT earlier rather than later. And specifically, those benefits are around osteoporosis, so that's the strength of your bones, cognitive decline, so conditions such as dementia, and also potentially conditions such as diabetes. We know that it is better to start HRT before you're 60, and certainly within 10 years of your period stopping. So specifically, I had a lady who was 42 and was very keen to consider HRT. And she didn't at this stage have a lot of symptoms and was still having a regular cycle, but was troubled enough to come was obviously troubled enough to sort of pose the question. And the important thing is to ensure that HRT is safe. There are contraindications to HRT, and it's not for everybody. But if it is safe to prescribe, then there is often a rationale for saying, let's try it for a short period of time. And often I would suggest that that could be a 3-month period of time. And if HRT is going to help, then it will often help your symptoms quite quickly, often within the first weeks. The other thing we need to think about is, your total time on HRT. Now, there are obviously very specific circumstances where women do have a a premature menopause, and that's before the age of 40, or an early menopause, which we sort of define as before the age of 45. And in these circumstances, it is particularly important to take HRT because, we know women need their hormones until they get to their early 50s, that's until they get to that sort of average age. So whilst we would be inclined to often say that we would always generally recommend that you stay on HRT for 5 years, probably up to 10, and then have some further discussions about benefits and risks that come with longer term use. But it depends on your symptoms, your age, and any other risk factors that you might have. So I think the answer to the question is no, you're not too young for HRT. We might, if you are, under the age of 40, we would definitely do some hormone tests. If you're under the age of 45, we might consider doing some hormone testing because that is a situation that we want to know about. And we would definitely be saying you need HRT. Like if your thyroid failed, you would take thyroid hormone. If your ovaries have failed early, then you should take the hormones that your ovaries would be producing until you were perhaps at the age of 50. So and as I say, I think in practical terms, it can be valuable to have a trial. And if it doesn't help, then you can stop.
Thank you. Yes, if you don't try, you don't know, do you?
No, and it is easy to have unrealistic expectations of HRT. And, I do talk to women a lot about that. But there is certainly 3 months of HRT is carries very little risk and will often give you a good answer if it's going to help your symptoms or start to help your symptoms. Of course, there might be some dose adjustment to be done to try and get the optimum effect, but you will usually know quite quickly if it's going to be good for you.
Thank you. Completely different subject is.
Oh yeah, a lot of those. Okay.
So we have somebody who goes swimming or likes to go swimming, but has a persistent ear infection. And obviously is always told, don't get your ears wet. How long should they carry on not swimming?
I think it's a really difficult question. And the most important thing probably is to make sure that you've got the right diagnosis for your ear discharge, because there are several things which can cause ear discharge. I mean, earwax is normal. We all have earwax. The natural history of earwax is that it moves down your ear canal and then it sort of dries and crumbles and comes out, and most of the time you're not really aware of that. But sometimes it can form a sort of quite a dark sort of discharge, and sometimes you see people with discharging ears and what they've just got is actually earwax. So that's a nice reassuring simple diagnosis you can make. Very rarely we might see discharge from an infection in the middle ear. So that is the part of the ear which is the other side of the eardrum. And sometimes when that gets infected, your eardrum gets red, you have a very painful ear, and your eardrum can sometimes rupture. So you end up with a hole in the eardrum, and then the fluid, which was contained in the middle ear, comes out through that hole as discharge. Now, if you've got a hole in your eardrum, then even that doesn't mean you can't swim. You certainly shouldn't go diving. I mean, don't go scuba diving because you're going to have an issue with pressure, obviously, and probably get a significant amount of pain. Flying is something, again, which, you can manage, but, it's just to be aware of. But I suspect what this patient is describing is what we would call an otitis externa. So that's an infection actually of the ear canal. So part of your ear canal is lined with normal skin, and it is susceptible to all the other conditions that our skin is susceptible to. And the reason, and it was called swimmer's ear because repeated exposure to water can make that skin in the ear canal much more vulnerable to infection. And interestingly, we see it probably as well related to chemicals in swimming pools. We see it a lot when people come back from holiday. So maybe as well when they've been swimming in the sea, or when they've been in, again, swimming pools with a lot of chemicals in, which have caused an irritation and which has allowed an infection to get in. We see it in people who clean their ears out with earbuds, which is very much a situation to avoid, because that traumatizes the skin that lines your ear, and so leaves it much more vulnerable to infection. So if we've got if this patient has got the diagnosis of a otitis externa, one of the key things we say is you need to keep your ear dry, because we've just said that exposure to water can make you more vulnerable. But we see it a lot in children. And, swimming is a vital life-saving skill. And you would have some children who would almost never learn to swim. And this is a condition some people get a lot of, some people never get it. It probably relates a little bit to the anatomy of your ear canals. So I think you have to be quite reasonable in your advice. And I say, yes, swim, but make sure that you really dry your ears after. You can tip your head, drain the water, a hairdryer, a coolish hairdryer. Make sure you straighten your ear canal by pulling your ear backwards, and dry your ears out. And I think that with those sort of precautions, you can continue to swim. And there is some over-the-counter medication that you can also use to perhaps use after you've swum that might prevent infection. And, I think we're seeing this a bit more. You think how many people you see using in-ear headphones now. And we know this is a risk factor with earplugs, hearing aids. And I think these are, probably in-ear headphones are contributing as well. And do you clean your earphones on a regular basis?
I doubt it. That sort of leads me on to think of another point. If you share, those with other people, is that a good way to pass on infections?
It can be. Yes, certainly if you've got a discharging ear, I definitely wouldn't want to borrow your earphone. Thank you very much. And we're always very careful in surgery that we always examine the good ear first, so that we look at the infected ear second, so we're not transferring anything necessarily on our equipment. But yes, you shouldn't really probably share your probably not going to share your hearing aid, but you probably really shouldn't share your earplugs or your in-ear headphones, because that is potentially a way to share any potential infection. So that's a really good point.
Moving down to the bottom of the body and thinking about fungal nails. It's always a hot topic. So the person has come and said that I imagine that they get a lot of fungal toenail stuff, and they've used a lot of the over-the-counter stuff. But is there actual medication that they can get under prescription for fungal nails?
Yes, there is. I mean, this has become almost ubiquitous. I wonder what percentage of the population do have fungal toenails. And I've I've asked, colleagues and podiatry colleagues why they think this could be. I initially thought maybe it was related to the fact we all wear nail polish on
What you
our,
mean it's on the up?
absolutely on the increase. I mean, I
Right.
don't remember seeing so much of it 25 years ago. And now just see it all the time. And I think we just see the tip of the iceberg. Goodness knows how many people are, managing it at home with over-the-counter preparations or just ignoring it, because
Uh,
that is.
and is that across all ages and both sexes?
That's what then, when I started to see a lot of it in men who, really are generally not wearing nail polish on their toes, I thought, okay, I've got to look for, there must be another reason. And actually one of a podiatry colleague said that they think it very much relates to us all washing at lower temperatures, and that we're all washing at sort of 40 degrees or less for economic and environmental reasons, and that is not a high enough temperature to kill fungal spores. So I could sort of understand that as a very reasonable explanation. We footwear is more synthetic. We probably don't expose our feet as much, that there is some reason why fungus is growing more often in our feet than it used to, and I'm not entirely sure which it is. But
I was just going to say maybe because people don't, whereas 25 years ago, people had more baths than they did showers. So you're going to have less exposure to the hot water on your feet in a shower, I would have thought, than you would in a bath.
I don't know if a temperature of your shower would be enough to kill your spores. I just don't. I don't know. I think it's hard to find an explanation, a clear explanation, which seems to be universally agreed. But it is a big problem. Most of the time, it is more about cosmetics, that it doesn't really look very nice. But sometimes when you get a fungal nail infection, your toenails can become quite thick. And then particularly in footwear that is maybe quite compressive, you can actually get pain as that thickened nail bed is compressed, as that thickened nail is compressed onto your nail bed. And it can actually be quite painful. They can also become incredibly difficult to cut and to manage. So there are a number of reasons why I think sometimes people come to us. Often they've tried over-the-counter preparations, the lacquers and the creams, and they've not had much success. The podiatrists and chiropodists do offer some alternative treatments, which, to be honest, I don't know very much about, but seem to I'm not entirely sure what they involve, but having discussion with patients that I see, they've often sort of considered that as well. But of course, that comes at a financial cost. So they come to us really wanting tablets to treat their nails, which don't look very nice. So then you've got quite a dilemma around, the risks related to treatment, around the benefits of having, nicer looking toenails. And some of the problem is that the medication that we use to treat fungal toenails does have some serious side effects, particularly around liver toxicity. And also you need to take it for about a year, at least.
Oh, wow.
Toenails grow really, really slowly. It probably is at least 6 months to a year before your toenail goes through a sort of cycle, if you like. So you need to take it long term. And so to take a medication with side effects for a year or more is quite a big ask of your body, because of course the effects are going to be systemic. They're not just on your toenails like the lacquer or the cream would be. So our approach is, the question was, I think, sorry, going back to the question, can I take medication for my fungal toenails? Well, we would generally in my GP practice, we would need to prove that you have fungus before we considered giving you medication. And a lot of the time, it's not always fungus. Sometimes it is actually just repeated trauma. And maybe, again, that's with fashionable footwear, that's with high impact exercise. You do see that we send a lot of clippings off and we don't always find fungus, although I have to say that the false negative rate for culture can be quite high, about 30%. So we might send them off, they might say no fungus, where actually there could still be fungus. So I will often take a repeated sample if I think that's necessary. And then really it's having a discussion. If we have a positive result, it is having a discussion around how the medication would need to be taken, and potential side effects, and of course cost. At the NHS, every time I sign a prescription, I have to think that I'm signing a check and I'm spending NHS money, and that's something that we unfortunately have to consider more and more in this current climate, which I'm sure people generally would understand.
And I think also, I mean, that's the point about taking medication, is that when you're putting, we go to the doctors and we expect to have a pill that's going to cure us straight away. And we don't really think about the side effects, that it's because it can't just say, right, this pill's just going directly down to my toe. Which
Absolutely.
I think, you just don't know that. And I suppose that sort of leads on to a conversation about side effects from medication in general. In fact, earlier we were talking about exactly that. Somebody that you had mentioned about having a dramatic side effect.
And this is always a problem. So obviously, as the prescriber, I have responsibility to ensure that I'm prescribing safely and appropriately. And I've got a massive formulary of medication, which of course, I am not, it's impossible to know every single detail of every single medication. It's really important when you are prescribing a new medication that you do have a discussion about the potential risk-benefit ratio of that medication. Obviously, the benefit, we would hope, is that your fungal nail infection would get better, but there are always going to be risks against that. And, some benefits are much greater and some risks are also much greater. So, I mean, there are just some simple examples, in particular, obviously, antibiotics. It's important to, advise around allergic reactions. It's important to advise around antibiotic resistance as well, that, people are always, there's always a request for antibiotics, and sometimes that's not always appropriate. So those are discussions that that should be had. I had an interesting case of quite a severe side effect, which actually was a seizure relating to some medication that was prescribed. Now, on prescribing that medication, the more usual side effects were discussed, which was very important and appropriate. But if you look at the data sheet around individual medications, the list of side effects
huge,
run 20, 30, and then you're in a position of I mean, that's an impossibility in a consultation. That's an impossibility to look at every single potential side effect, and some of them are extremely rare. And I think on both sides of the fence, I think, you might, as a doctor, we would be seeing, wouldn't have time to see the number of patients we need to see if we were going to go through all the details of all the side effects of every medication we prescribed. And from a patient point of view, it can be not appropriate to share, you know, every single more serious side effect, because, you know, people might not take any medication which is important for them to have. So it has to be proportionate, has to be balanced in that, you know, with those risks against those benefits. And obviously it is really unfortunate when anybody suffers a significant side effect from a medication. And there is a huge amount of safety procedures in place around prescribing, and safety and procedures that you know, we go through when we feel someone has suffered a significant side effect, to add to that database around that medication. But I think as patients, it's really important that, you know, we all inform ourselves all around the medication that we are taking. You know, all medication does come with a detailed leaflet around constituents, but includes side effects. And I think it is our responsibility to inform ourselves around those. And if we are particularly worried, to perhaps have a focused discussion around any particular side effect that you know, you might be experiencing, and is it related to that medication. Obviously, you know, medications are withdrawn very promptly if a serious side effect starts to appear on a more frequent basis. And I think we all need to be rest assured that as long as you are taking a, you know, prescribed medication, then you can be pretty certain that you can be certain that it's been through a very tight regulatory process, and these are updated all the time.
And it's funny, isn't it? Whereas people are very kind of hot on prescribed drugs and understanding those things, and then they might just go to a local health shop and take, which
Oh, yes.
haven't gone through anything.
Oh, yes. And some of the most serious, well, I'm just thinking of a couple. There's always a couple that stick in your mind. You know, quite a significant liver dysfunction that related to taking some Chinese medicine. And, you know, there are a lot of unregulated medicines out there which are not medicine, you know, that they've not gone through the process.
But if they've got natural written beside it, I think people think that means they're fine. And I think we know that they're not fine. So
and
that is,
yeah, I think that is and people think because it's herbal that it must be that you know, it can't be too strong, or and that's just not the case. And I definitely would say think carefully about what you take, particularly, you know, when you're taking off the internet and all that sort of thing. It is it is important, you know. It is, you know, a medicine needs to go through a strict process in order for it really for you to be to take it safely.
You know, and not to labour the point, and I think what you've just said is really important. It's not just that, it's also where you get them. So you might get something that's labelled, looks like it's been labelled correctly, but if you didn't get it from your doctors, you got it over the internet, you just don't know where it's really come from.
I mean, and I'm sure there are very reputable sources. I wouldn't know what they were, and I wouldn't want to make a comment. And of course, you know, that's can be very, you know, that can be very helpful. But I think you need to make sure that you're looking at a really trusted source of obtaining any.
And I don't mean online pharmacists, by the way.
No, absolutely. But it is other, as you say, it is other sources of more of supplements and and vitamins and herbal and that do sometimes cause some concern. And you know, thinking back to the first case that we discussed around HRT, you know, the argument around, you know, bioidentical HRT, and that was very, women were seeking that out, and it was just being made by various you know, sort of pharmacists or chemists without any real regulation. And we saw it with when we had the, I don't know if you can recall, when the MMR vaccination became you know, had a scare, and instead of, so, you know, understandably parents got very anxious about giving the MMR vaccination, and they wanted the vaccination given it individually, and most of those preparations were actually not licensed. So then you're in a situation of using an unlicensed preparation.
Not
So
great.
it's not, sometimes there are no, you know, there are no ideal options.
Well, on that note, but there are lots of good options available, though.
There are, yes, there are. Yes, that sounded negative, and I didn't mean it to be, but sometimes there's not, you know, there's not, the solution is not always straightforward.
Absolutely. So thank you very much for coming back to us today and to going through some of the questions that we asked. And I think what's very clear is that when we answer a question, or when you answer a question, it is like going to a doctor, because what's nice is you're not just answering straight off, you're giving some background and some reasoning, which I think everyone will really appreciate. So thank you very much, Kate.
Absolute pleasure. Thank you.
Thank you.
Bye.